Hello there. I don't often do this, but I am actually compelled to do it today upon the death of my very dear friend Jay Franklin in Melbourne. This is a message to the Australian public, friends of Jay's, but also to our nation's Federal Health Minister, Greg Hunt. In 2004, Jay Franklin was part of a Senate inquiry into the worst medical disaster in Australian history, tainted blood. 20,000 Australian hospital patients were infected with viruses from blood transfusions. We submitted evidence to that inquiry of very real criminal conduct by the blood services and the government, which led to people being infected with viruses that they might not have otherwise been infected with. There were real measures that could have been implemented that weren't, and that led to people like Jay being infected. The Senate recognised this and made a raft of recommendations. It unanimously agreed upon those recommendations and instructed the Federal Health Department in 2004 to initiate a group of measures to help people like Jay Franklin. One of those things was home help, home nursing, alternative therapies if conventional treatments wouldn't work, which was often the case for thousands. Things like cannabis, things like home help, home nursing. All of these things were denied by Greg Hunt. I wrote to him twice in the last year and his predecessor, pleading with him to comply with the Senate. Taxpayers' money had gone into funding that inquiry in order to work out how best to help people like Jay Franklin. Well, it's too late for that now because Jay Franklin has died. And if Greg Hunt had complied with the Senate and had acknowledged our letters, Jay would still be alive today, and if he wasn't alive today, he'd have had a far better experience during his lifetime. Greg Hunt, please resign. You no longer represent patients in Australia, and in fact you're committing crimes against us. Jay Franklin's death is an absolute disgrace, sir. You were written to. We pleaded for you for help. That's all I've got to say.